We're joined by our two esteemed guests and friends. Tom Bollyky is the Director and Senior Fellow at the Council on Foreign Relations, Global Health, Economics, and Development. His full bio is available to you on the website, along with Stephanie Segal's full bio. His output is prodigious. The generation of just remarkable analysis and good ideas around how we need to think about this big picture. And we'll get into more of that in the course of this discussion. I had the chance to go back and reread the last dozen or so pieces that he's produced, and again reminded of just how impactful and creative and analytic all that work is. So Tom, thank you so much for being with us. Stephanie Segal is the senior economist at CSIS in the economics program. She's a member of the CSIS Commission on Strengthening America's Health Security. We had the great honor of and benefit of having Stephanie produce a recent analytic piece for us over the course of several months, with a working group involved in looking at the options that we have in trying to address a pretty critical and urgent problem of economic distress, risk of fiscal insolvency among low-income and middle-income countries that have many seen the pins kicked out from underneath their economies in the force of this pandemic. Even if the pandemic actually didn't arrive at their shores, the economic force of it did. And Stephanie's been a great partner and very creative in pushing these ideas forward on what more can be done to match things up. So I'm going to turn to Tom first and ask Tom to share with us your reactions to what we've just heard from Gail. And then I'm going to ask you a couple of quick questions about your work, and then come back to Stephanie, ask her reactions and a few questions around her work. So over to you, Tom.
Great. Well, I will say first and foremost, thank you for having us both here today for this important discussion. It's always a pleasure to engage with you and this audience in particular. So I'm pleased to be at this conference again. I think it's enormously encouraging to have someone like Gail, and Gail in particular, in this role at the State Department. She has tremendous expertise in these issues, has been around them for quite some time, and is both right-minded and right-hearted in what she's trying to accomplish on global vaccine equity matters. So that's a great step. I think the administration is starting to do some good things engaging on the global vaccine issue. It's positive to see the president's commitment of 80 million doses. I don't know if you've seen this already, but there is a press release put out by the White House today on what the allocation of those doses will be. So there is some indication that they will prioritize high-risk settings, at least for this initial tranche of doses, as well as working through COVAX. So that's all positive. I think a lot depends on what happens next with the G7. And obviously she's encouraged by the direction we're going there, but there's going to be a lot more needed. Not just in terms of available doses, whether they come from the surplus doses that the countries themselves have procured, or by mobilizing manufacturers to fulfill their promise to put out, I guess, 1.3 billion doses this year at cost to low and middle income countries. There's going to be a lot that needs to be done to facilitate and expedite those donations. She also echoed what I think is quite true, that even with meeting the short-term vaccine needs, that's not going to be sufficient in this crisis. We've seen, in terms of the doses that have been administered globally so far, 3 out of 4 of them have gone to just 9 countries. That is the same 9 countries, largely, that make them. So if you're in a country that is not a vaccine producing country, it is not surprising that you want more manufacturing capacity in the future, so you are not left waiting for months before vaccines should arrive. So I think in terms of meeting that demand for greater global distribution of vaccines, manufacturing capacity and of their inputs, and in terms of also potentially meeting future demands for more doses, whether they arise because of variants and the need of boosters. If we get to that point, it's going to be really important to hear what the medium and long-term game is too. But it's positive, I thought, to hear from her that there's been some progress on the shorter term agenda of what we can do to free up doses now through donations and working through companies.
Tom, hold for a moment. I'm going to ask Stephanie to share with us her reactions to what we just heard from Gail.
Sure. And first, just thanks, Steve, to you and to the World Affairs Council for hosting us and for identifying this issue, first and foremost, as a health issue, but making very explicit the linkage to economic outcomes. And I think that was, listening to Gail speak, the top takeaway for me, and I come to this discussion not as a public health expert, but as an economist by training, Gail made the very correct point of this linkage between the health and economic and financial issues is one that is clear in the current crisis context. But one of the, hopefully legacies of this crisis is that sort of thinking of making explicit those linkages and thinking about long-term planning, linking economic issues and the creation of fiscal space to dedicate to public health, that's something that actually endures beyond the current crisis. So I was quite encouraged by what I heard from her, and she actually identified, the two responsibilities she has, the very near-term global response to the current crisis, but then thinking about global health security over the next 10 to 15 years. And I know, Steve, you've been doing precisely that. The commission is doing precisely that. What that means then from kind of an economics perspective, or for folks sitting in finance ministries, is precisely what she said about the sustainability of that sort of investment. So it is the job of finance ministries to be thinking about how you make those investments sustainable. And as Gail articulated, I think trying to rely on donor financing into perpetuity is not necessarily the recipe for predictability or kind of long-term sustained commitment to health. So really embedding that thinking with finance ministries, I think, is critical. And it is encouraging to hear that is how she's thinking about it. And I agree 100% with her that there is maybe an opportunity right now to kind of take advantage of the moment. There's a recognition of, health as a global public good. There's also recognition of climate, for instance, as a global public good. And thinking about how you make investments in those global public goods sustainable is exactly where the discussion needs to go. And so I was encouraged by pretty much everything I heard her say. And now I think it's the hard work of how you translate understanding and commitment of those ideas to actual policies. That's what lays ahead of everybody.
Thank you. Tom, here at home in the United States, many people sort of see Operation Warp Speed in the early phases as reasonable, as a success story, followed by the COVID-19 response team that President Biden has put in place, and the plan of action, and the sort of well laid out thing that built on those innovations under Operation Warp Speed, which put a great focus on supply, right? And you've been one of the voices that early on said, if we're going to have some kind of global solution, we should start with the thought that extending some of those capacities and logic from Operation Warp Speed into a strategy. And you've written about that in different contexts. you've called for a vaccine investment and trade agreement approach, and you've laid out, COVAX has to be terribly important. You have to put a focus on inputs for production. You have to get out of we can't be screwing the rest of the world with export bans and other things that skew markets and supply chains only in our favor. We have to have transparency and trust in the rest of the world that we're playing by some set of rules or common rules. And that the vaccine marketplace is a very untransparent, chaotic place, and with not a whole lot of clear governance to it. My question to you is, those ideas, it seems to me, still remain terribly relevant to this whole conversation here today. Are you seeing progress towards that, in that direction, as you were observing some of the, the proliferating initiatives and thinking that's coming out of these different fora?
Yes and no is the short answer. So I think the areas, well, a couple of things. Just to build on Stephanie's point, I hope the lesson that the United States and other wealthy nations ultimately take is that this is a collective action issue and that we invest in it as if it were. I do think that would be a departure from the last 20 years of global health, which has mostly focused on it as an aid issue and addressing low and middle income countries. And this issue around how we approach vaccine manufacturing and scaling up capacity, I think is going to reveal how we see this in the future. Is it important that we have distributed, scaled up capacity so that we can all respond sooner? Or are we going to largely focus on ramping up output to then provide to low and middle income countries in this particular crisis? And I think we're getting some mixed signals from that. On the positive side, and you're right, we've been talking about this issue. I think the first piece on it was last April. So we've been pushing on this issue to start to address this for some time. What I think the lesson of the Operation Warp Speed domestically was, in order to scale up production, you need both financing and policy support. You can't just have large purchases of vaccine doses. It really requires, in a crisis, governments to facilitate the connection between input providers and final manufacturers and subsidize. And frankly, the US is really the only country that did that. You did not see this level of subsidization of input providers in Europe or anywhere else. And I think it has shown in terms of the outcomes that we've been able to produce. People really focus on the use of the DPA. DPA use has been relatively limited in the United States. It's really what we've done around the coordination and subsidization of input providers that has made a difference. All this is to say, moving forward, particularly with the talk about how much companies are expecting to ramp up production, this input issue is going to be real, where you have numbers being put out now in terms of commitments of what Pfizer and other companies are going to provide to low and middle income countries above and beyond what they've already sold. That is really going to take a ramp up of input supplies and put a stress on the system. So I think this is going to be really important moving forward. I think the areas where we're making progress is, there's been certainly some talk among the European Commission about supporting African manufacturing to scale out manufacturing in that regard. I think there's some indication that the WTO sees this as an investment issue, not just an issue of intellectual property, and fits well into this conversation. I just don't think it's entirely clear what's going to come out of the US and Europe, if this is primarily going to be about ramping up domestic production to donate to the world, or we're going to see this more about building an architecture that makes us safer for the future. So again, this loops back in, is this a collective action problem for us? Or do we largely take the lesson that we can deal with this by producing vaccines faster for domestic needs? And keep ourselves safer from that perspective.
I mean, when you look at the range of issues that have to be brought together under one roof somehow. If you're talking about the US government engagement, if the US is stepping up its international engagement to wrestle more seriously with these challenges, which are both emergency and long-term preparedness, it's a matter of amping up the diplomatic muscles significantly. It's a matter of industrial policy. I think my translation of what you're saying is, in Operation Warp Speed, we weren't shy about putting our political muscle up against the marketplace and saying, look, this is what you get from us in terms of not just pre-purchase at-risk production. You get the full benefit of us muscling markets, but basically the quid pro quo is we're calling the shots here on most of this. And so it's industrial policy. We don't like that term, but it is in some very important places. Then we have IP and trade policy. We have financing. We have AID responding on emergency side and developmental and health programs, but also controlling the relationship with Gavi in terms of money and vaccine delivery and the like. There's a very large spectrum of complicated areas of policy that have to somehow be integrated into some kind of strategy. And what we see is important initiatives launched here and there. I don't think we see a coherent team nor a coherent strategy quite yet. That may be asking too much. What's your reaction to that? And then I want to turn to Stephanie about whether she sees a coalescence around some of the issues where earlier in the year we weren't seeing quite as much sense of urgency and action.
Yeah, so I agree with your take. It is industrial policy, and that is the best way to think about it, because ultimately it is about the policy and financing support and, quite frankly, the organization of markets. I think there's a lot of thought early that if we had a large enough prize, markets would self-organize at this speed, and that did not happen in most markets. It was really through this active intervention of government in connecting these providers. Why that's important moving forward is most markets, pharmaceutical markets or vaccine markets, aren't as large as the United States. Right. You know, this idea that by freeing up intellectual property, you'll see more manufacturing abroad, maybe of some forms of finished manufacturing you do, but where are the supply chains to support them? And you don't have that level of production in most of the markets. They're too small. They can't support the range of input providers you need to. So you need this cross-border coordination and investment to occur to allow this to happen. And that can only happen through an initiative like this global Operation Warp Speed, where you're really having that coordination happening on behalf of a collection of governments. So I think that's going to be really important. So I think you're spot on ultimately in terms of that take. And I think it goes against two impulses. It cuts two ways. One, we want to make ourselves safer against future pandemics, but we are also having a larger conversation about reshoring manufacturing in this country. And, you know, that is also a priority for this administration to build that. And I think those two impulses cut opposite ways, and we're going to have to figure out how to resolve them in the later stages of this crisis.
Stephanie, I'm sure you have a lot to add in response to what Tom just said. So before I dive in on some related issues, I wanted to ask you to respond.
Sure. Yeah, I love listening to your conversation, actually, and I do have a lot of kind of reactions. I think the important thing when we talk about industrial policy, so we're talking about industrial policy in the presence of a global public good. And what that means is, to sound like an economist, there are positive externalities associated with investment in health, investment in vaccine development, and acceleration of production. So it's that link, it's identifying health as a global public good that is really the impetus for government involvement. And it's not necessarily undermining kind of the market mechanisms or undermining a market economy. It's recognizing when there are those positive externalities that the government should come and weigh in and encourage a certain outcome, because that actually does accrue to all of our benefits. And that's what I was kind of getting at before, that we have an opportunity right now where when people talk about global public health as something that is, important to long-term economic growth and stability, it's not some abstract concept. We actually see what has happened because we were not prepared in the way that we needed to be to respond to this pandemic. And the cost of that is in the trillions of dollars, not to mention the many millions of lives lost. And so the opportunity is that this is not some abstract idea right now. It is actionable and it's actually quantifiable. We know what the cost is to not doing it. And so I think that makes for a very strong case for government involvement, not necessarily taking over markets, but really taking advantage of the market mechanisms. The government can weigh in and achieve those desired outcomes. So that was kind of my thought in listening to your conversation there. I agree 100%, and it's really drawing that link between the global public good and where the government needs to weigh in.
Stephanie, earlier this year when we were meeting, preparing your paper, we were having public sessions, private sessions, and looking at the SDRs, special drawing rights, looking at the common framework that the G20 was moving forward on debt renegotiation, looking at what the multilateral banks could be, what more they could be doing. They were all cogitating. You had the DSSI and then sort of suspension of payment extended for the low income and lower middle income countries that were under particular debt stress. There were ideas were percolating, but I remember feeling like the discussion didn't have a sense of fear and urgency and scale driving it. In other words, when you looked at the magnitude of the problem that particularly low-income countries faced, and the threat of distress and insolvency was looming out there, it just didn't seem to match up with sort of the pace and the tone of some of these discussions. You might argue that, well, that's just a reflection of the lack of power that low-income countries have in the world. But do you think, my question to you is, do you think things have changed in the last period? Because there's this proliferation, the G20, G7, there's a proliferation of analyses coming forward that make pretty damn clear that this is a big deal, that this is an urgent house on fire problem.
Yeah, and I think, Steve, you started off your comments and started off the program with the topic of variance.
Yeah.
And I think, back to the point that this is not an abstract idea anymore. And we know, even in the presence of high vaccination rates in the US and really declining case numbers in the US, that the threat itself hasn't evaporated. The threat hasn't evaporated because we know that we're actually at, kind of peak of the crisis in terms of the number of cases. And that as long as you have outbreaks occurring, there's the potential for variants. Those variants can evade the vaccine protection that we currently enjoy. And so we're not, by any stretch of the imagination, out of the woods yet. And I think there is an appreciation for that. I think there's also an appreciation of the fact that advanced economies have been able to respond to both the health and the economic crisis with a massive amount of both fiscal and monetary support. So while we took an economic hit last year, it was moderated, and now we're seeing a very strong recovery. Low-income countries and many middle-income countries have not had that same benefit. And so we need to worry not just about the health crises in those places, but the economic crises that are more enduring because they haven't been able to bring that same sort of policy response. And in order to have a healthy global economy, markets for us to export to, we need the entire world to be recovering. And I do think there, is an appreciation for the US and other advanced economies leading not just in the resources that are necessary for health, but in the broader economic response. And that gets us, you mentioned SDRs, these are special drawing rights at the IMF. There's kind of interest and appetite for getting those resources to countries that need it. There's interest and appetite for making sure that the World Bank and other regional development banks have the resources they need to help with the recovery in these countries. So I do think we're at a different place, and I think that's because we realized the threats that we were worried about a year ago have actually been realized in many of the biggest economies around the world.
So if there's a change of consciousness among the policymakers and those professionals who are working these issues, and a newfound sense of the gravity and the scale and the urgency around all of this, that's a very important moment that we're in. The follow-on question is, how does that reality get conveyed to the American public? Because I still sense that this administration is moving very cautiously. It's done a scattered number of very important things that have been creative and important, but it's almost like each one is a bit of a trial to see what can achieve some results and not overcommit, but they're kind of trial balloons in a way. And we're not out of the woods yet domestically. We're moving ahead at a very accelerated pace and very promising pace, but we're not out of the woods. And we may still, Chris Murray last week from the Institute of Health Metrics and Evaluation was predicting that as of September, 30% of the adult population will be unvaccinated, and 20 to 25% of those who have been vaccinated will have waning immunity and be subject to breakthrough infections, which means 50% of adults back in the game. Now, you don't have to agree with those, but that's a frightening projection or forecast. Back to the White House. The White House is got its, as understandably, has its focus on overwhelmingly on this. And in looking at the international agenda, understanding it needs to do far more, but being somewhat cautious in that. In order to move ahead, it seems to me we have to have a more deliberate and targeted campaign to the American people around this. Tom, what are your thoughts on that?
I agree. I think that we have been cautious for some time. We've been producing vastly more vaccines than we are administering per week. I think it's fair to say the US has more vaccine doses in its freezers than we've distributed, or than COVAX has distributed globally. So I am encouraged that we're taking the steps we're taking now, but it has been quite deliberate. I think, to be fair to the administration, obviously it's a once in a century crisis. People, it's hard to predict exactly what's going to happen, what variants we might see. As the part that I definitely agree with Chris Murray, that is, I think there are going to be significant pockets of under-vaccinated populations, particularly in the South.
Yeah.
And we're going to have significant areas of vulnerability, depending on what resurgences we see in the fall and what variants might arrive. Right now, from an epidemiological perspective, the evidence is pretty encouraging. We have a fair number of the known variants circulating in this country, and we're not seeing surges. But that, of course, may change if they really start to make headway, or we see new emerging variants start to make headway among these pockets of under-vaccinated people. I share your concern, though, that we've had a few references. The president in his congressional address mentioned the need for the US to be the arsenal of democracy again and share doses globally, but he did emphasize that every American who wanted a vaccine would get one before that occurs. And this conversation, I think, is one that we're going to have more often and more in a high profile way to convince Americans, particularly with the amount of investment you reference in your opening, how much this will take, but also potentially the need to make some sacrifices to engage more globally, even beyond financing, where perhaps we send more doses abroad before we get to very small children in terms of the vaccines that we're talking about. I haven't seen enough of that conversation. I think we will have, like you, I think we'll have to do more in that regard.
Stephanie, what do you think? I mean, in terms of engaging the American public from where you sit?
Yeah, I think there are kind of two separate issues, and one is kind of what's the public health messaging to a domestic audience and kind of limiting vaccine hesitancy, and that's a distinct issue from making the case to the American people about why investment in global health, and that means sending resources outside of the US, is actually in their best interest. As I mentioned before, I think circumstances have made making that case that much easier. It's pretty obvious how we're all being impacted by outbreaks elsewhere in the world. But I think some of the points that Gail raised about making that sort of commitment sustainable, the transparency and accountability and oversight to US support abroad, I think that's critical. We have to demonstrate to the American people that that sort of investment is producing results, that we know where that funding is going, and that it's actually going to the sorts of reforms that strengthen long-term public health capacity, public financial management. And so this isn't actually new. PEPFAR and other interventions actually did exactly that. So you provide the financing, but along with the financing, you get the kind of ongoing support for public financial management, for transparency. And so that needs to be integrated into any strategy that provides this sort of support. And again, this is, one of those, it's an opportunity, right? This is work that's already happening. But if we have to provide additional support, it should come with those sorts of strings attached, in the sense of strings that actually benefit and strengthen the systems. And I think, the American people are smart, our representatives in Congress are smart, and they can understand, that linkage to transparency. And one final thing on the transparency point, that's true when we're talking about health interventions. It's absolutely true when we're talking about other kinds of financial interventions. And there is a lot of focus right now on transparency of investment, transparency of lending, including by other countries. And all of that agenda is also critical in an economic and financial sense. And so I think it's helpful to have a focus on transparency when we're talking about health interventions and more general economic and financial interventions. They're complementary to one another.
Thank you. I mean, what worries me is, when you look back at PEPFAR, when PEPFAR was launched in January of 2003, and then it became operational in the next year, you had the Global Fund come into being, you had a very full bipartisan support within Congress, and that was echoed in the constituencies that surrounded all of this, the faith community, the implementers, the AIDS advocacy community, and the like. And it laid the groundwork for what's become a big success over the next 2 decades. What we have right now is a massive agenda that's very expensive. As we said, the next 18 months are going to take 50 to 75 billion to arrest the vaccine gap and the crisis there. And that's just the first piece. And then we have the longer term. And what worries me is we don't have a solid bipartisan consensus around this. And we have a $6 trillion budget that's just been tabled that has become quite a divisive measure. And we have anxiety around inflation and economic recovery and all of that. So making the case is going to require a pretty careful and well thought out strategy of convincing all sorts of Americans that this is essential to make America safe and to secure our own gains, and that it is going to be expensive. That just seems kind of inevitable with this big price tag. We have a couple of questions from the audience that I'd like to turn to there were a couple of questions about WHO, which, which were around, does it matter to us? How much does it matter to us? How much damage did it suffer under the previous administration? Is it on the path to recovery? Maybe each of you could say a word about where WHO fits in your estimation. There's oftentimes excess expectations placed atop WHO, which is a weak institution, underfinanced, with very constraining governance rules that apply to it. But nonetheless, it remains very important. Tom, what would you say? And then Stephanie.
Great. So I'll say two things. One thing, I just want to make a remark on your last set of comments, which is, I think there could easily be a narrative that ultimately what we need to do is produce vaccines faster. The UK's initiative around the G7 is trying to reduce the production or development of a novel vaccine to 100 days. I think you may see voices in Congress point out that Operation Warp Speed was primarily a domestic initiative and delivered. So I don't think it's a foregone conclusion, despite absolutely everything Stephanie saying is true about the broader economic costs of this pandemic, that the conclusion that some politicians will draw here is that we need to have this kind of global investment as opposed to expediting the vaccine production for domestic needs to make us safer in the future. On the WHO side, I continue to think WHO is in fact critical. I think in terms of how they emerge from the crisis, certainly there were some things mishandled. I think people will almost universally agree that WHO was too credulous of the initial complaints about transparency from China and was at least a week late in declaring a public health emergency of international concern. I don't think you get that many people disagreeing. Even the independent panel basically said those two things. That said, there are a lot of low and middle income countries, despite in the absence of vaccines, that have managed to do reasonably well for a long time, and WHO, as providing technical support to those countries, deserves some credit for that.
Well, they're a lifeline.
They're a lifeline, and they've been absolutely essential in that regard, and I think will be essential moving forward. The part I worry about with WHO is what we're going to do ultimately with this origin investigation and the position that puts WHO in. Is this just a matter of tactics? Ultimately, something as part of a larger great power competition to point out around China, or will countries genuinely see this as a strategy, an objective to insist on an investigation and try to ratchet up pressure to arrive at that? That will put WHO in a very tough position that it frankly doesn't have the institutional capacity to resolve. So from that standpoint, that's my worry. I think the broader WHO reform issues are perennial. As Steve painfully knows, I can't even recall how many WHO reform conferences I've been to over the last 2 decades. We will have more. I think the best chance is to have it in the way that Gail suggested, which is to embed it in this larger agenda, and maybe that allows us to make progress. But again, my worry about the future of WHO really, frankly, is around how the geopolitics around this origin conversation happens, because it could be quite destructive to them.
And it is very hard to imagine how to get out of this box unless the Chinese suddenly decide to throw open the doors on logs and messages and at the Wuhan Institute of Virology, which is just, they're pretty dug in. So I'm not sure where we're going to get to the bottom of that. In terms of the human species, they've done quite a survey, but they haven't come up with a clear link in terms of the intermediate species. And so we're kind of left without a whole lot of evidence to support either proposition, but a lot of pressure to pursue both at the same time. And I just don't see how. Stephanie, what do you think? What are your thoughts as an economist? Does WHO matter at all?
Well, I was thinking, so I'm not going to weigh in too much on the WHO, but I can offer some thoughts on multilateral institutions, and I think about the international financial institutions.
Yeah.
As you're articulating it, multilateralism has its challenges for sure, but I don't necessarily see an alternative, and especially when we're talking about pandemics and global public health, it is not necessarily meaningful to have organizations that would exclude or work around large actors. In my case, thinking about kind of large economic actors. So it is certainly challenging, but I don't really see that there are, viable alternatives. I do think it's helpful. Two things. I think it's helpful to have, if there is an outlier state and an outlier state that's not working in coordination and collaboration with the rest of the global community, I think the more pressure, the better. I think multilateral pressure, can actually achieve the desired outcome. So it's essential, and I think the Biden administration certainly is doing this, but to work through multilateral channels and have other like-minded countries kind of delivering the same message, I think that's critical. The second thing, when it gets to kind of technical issues, and these international institutions that we're talking about are, bastions of technical expertise. They don't necessarily need to be political institutions, although they certainly have a political element. But in many cases, I think allowing the technical work to take place and not necessarily making things political and in the headlines is sometimes a better way to get at the desired outcome. So, let the technical experts work. I think that's what I've seen a lot in the international financial institutions, is sometimes to get progress, it's better if that work is ongoing and not necessarily turned into political arguments.
I mean, one of the silver linings of the COVID origin controversy, you could argue, is it's gonna raise the consciousness of our insufficiencies at home and in most other countries in terms of biosafety and biosecurity. Gain of function research of the kind that was going on at Wuhan Institute takes place all across the world, all across universities, state-run laboratories, independent private sector laboratories, people in their basements. And this is a problem. This is a serious, it's important to science, but it carries much higher risk, and it's more pervasive and democratized. And let's not kid ourselves. We've had serious leaks, lab leaks in the last 2 decades. It's totally plausible we could have had something similar happen here in the United States. So if there's more introspection about this problem today and more of a re-examination, that will be to the benefit. On the question of when you have the next incident, whether it's a pandemic outbreak, a suspected leak, a bioweapon, how do you get the experts into the site without getting hung up on sovereign interests, sovereign sensitivities, confrontations, state confrontations, and the like? That's a really hard thing to imagine. There's been discussion around creating some kind of new normative entity, and I think those are good, but I think that there's also a way, there's got to be some way of getting some of our best scientists talking to other scientists from other countries, including China, around this problem, and get some dialogue going, because it's, the next incident is just around the corner, and there are no clear norms or regulations, legislate. It's an open field in relative terms. WHO may tell you it isn't, but in fact it is. There isn't, there's not like a protocol or a game plan to turn to for these things. On the finance, we've got a few more minutes. On the financing, I wanted to ask a question around that's drawn from our audience. The high-level independent panel that the G20 has commissioned that's coming forward with some interim report next week and then a full report in July that's looking at pandemic financing options. Some of it comes down to, should we amp up the World Bank? Should we amp up the Global Fund? Should we do both? There are other options, right, as well, IMF and others. For each of you, what are the pros and cons? If we're going to have basically a pragmatic incrementalist approach that says, we're not going, the world has no appetite to go out and create some brand new fund. It may want a mechanism of coordination and governance and the like, but let's work with those instruments that we have that we trust and that they can do more and do more well. What is your thoughts on that, Tom?
Yeah, so a few thoughts. I think the issue is going to be whether they can gain consensus on what has made a difference in the variation in performance we've seen among countries in this pandemic. I say all that because if you're of the opinion what made a difference was getting effective vaccines sooner, you'll see more investment in CEPI and maybe the other intermediaries that are involved with the development and delivery of those kinds of medical interventions. If your view is that it's around capacity, health system capacity, or detection or preparedness, I think you have two challenges. One is that historically, we haven't done a great job in investing in those things and actually encouraging them to happen. The second is the available evidence doesn't really support that, in the sense that health system capacity is not correlated with how countries have done, even if you take into account all the kind of covariates and factors that might explain differences across countries. Pandemic preparedness metrics, whether it's the Global Health Security Index or the Joint External Evaluation Ready scores, are not correlated with how countries have done. So I think they're going to have a hard time mobilizing the type of support for that kind of capacity building if we can't identify for them what made a difference in this crisis and what might make a difference in another one. I think it's very sensible to look into investing in existing institutions. I agree with you. I don't think there's a ton of appetite to create new ones or create new funds, but I think it really depends. The form has to follow the function and where is this money going? And the only thing I see agreement on, unfortunately, is that we need better vaccines sooner. I think the rest of it is still in dispute.
Stephanie, what are your thoughts? You've given a lot of thought to this question.
Yeah, I think similar to Tom, I'm not a huge fan of kind of the proliferation of new instruments when we have institutions that do public health. And so I think the question is, how do you leverage the institutions that we have and allow them to be more effective? The other thing I want to kind of bring into this, the conversation, and we've been focusing on appropriately, the near-term need, the focus on vaccines, the focus on actual funding as opposed to commitments to fund in the future. That is all appropriate and the right way to go. But these institutions also have a role to play on kind of standard setting that has the potential, this is more on the kind of financial and economic side, has the potential to mobilize additional financing that makes these investments sustainable. So leveraging the institutions that we have, the work that they already do, and then using them for greater harmonization and standardization. And this is in particular for ESG investing, and health would fall under that. I think that's really the key.
Just explain, Stephanie, ESG.
ESG, and environmental, social, and governance. And this is this idea, it's usually talked about or more recently in kind of a climate context, but the S there, the social spending, is kind of health and education, and the G is governance. This gets at the transparency pieces that we've been talking about. That's how you unlock pools, huge private pools of capital that can make these investments sustainable, because you've got the private market investing in areas that are ESG compliant, which is where so much private capital is going right now. So there is a role for the international financial institutions for greater harmonization on ESG standards that can actually tap into this private capital. And I think linking the kind of near-term urgency to these longer-term goals, that's really what we're going to need to realize Gail's vision, your vision of global health security, and a real kind of long-term strategy to achieve that.
Thank you. We're almost out of time. There was one question that came forward that I had been asked earlier this week, and I want to put it out there. The American citizens living abroad, expatriates, living in Southeast Asia and East Asia, have come forward now to petition the U.S. government to take responsibility for vaccinating them. Now, there are 9 million American citizens living abroad. And I'm not sure exactly what the circumstances are that prompted them in this moment to come forward. I expect that India and the second wave through Asia is a factor. People were perhaps feeling more comfortable or complacent. Now they're uncomfortable and they're worried. Mobility by flight may be impaired or constrained, or the idea of going home to get vaccinated with an uncertainty surrounding this. All of those factors are probably swirling around. And of course, this raises all sorts of optical, if not very deeply ethical issues. If we're sitting on a mountain of vaccines back here that are not being drawn on by the governors because the demand is way down. Last week, it was 53 million in stockpiles, awaiting governors to draw their rights on those. If we're sitting on a mountain and we're parsing out fairly modest levels of donations, a targeted thing of this kind might be quite consequential, but it may be that we also are in a different phase of this pandemic where these sorts of protection issues come forward as part of an emergency context where Americans are in the habit in the past of asking our government if they're in danger to help them. Stephanie, what are your thoughts? What's your reaction to this? I realize this is not the domain of expertise for any of us, but it came up in the Q&A and it came up in a press conversation earlier this week. So it's a live matter as far as I'm concerned.
Sure. I mean, I can offer my thoughts as a layperson on this. I think we should be in the mode of, getting as much vaccine out there as possible. And that includes with, US citizens that are abroad right now. But I think maybe as part of a strategy, as Tom was referring to before, part of a strategy that is about vaccines to everyone. US citizens as part of that, that would seem in line with our ultimate goals here of getting as much of the population globally vaccinated as possible.
Tom, final word.
I will agree with that. It's really the short issue. It would have to be integrated into a larger program. I think it would be exceedingly difficult to do as a standalone, short of offering charter flights to fly Americans back for vaccination. I think it would be exceedingly difficult to fly. And part, we wouldn't have control over the doses because they'd be potentially on foreign soil. So troublesome.
Well, we have the career diplomat here to answer that question for us. Thank you so much, Stephanie and Tom, for giving us all this time and sharing with us all of your insights. This has been terrific. Thank you. Over to Charles, our captain here.
Well, Steve, I want you to ask easier questions, for goodness sakes. You're putting our guests on the spot. I mean, it is crazy that we'll fly people home. Maybe if we can fly them home, we ought to be flying vaccines to them rather than flying citizens home. It's a interesting question, and I don't have the answer to that. And I'm glad to know that Tom and Stephanie are scratching their heads as well. I want to thank you, Steve, as the moderator of this panel. I want to thank Stephanie and Tom for great engagement. I got to say that I'm scratching my head about Tom's answer that the countries whose health systems were really well prepared weren't necessarily the ones that did the best. That there's no correlation between the status of your health system and the status of the response to this. So there, wow, that's really something else. This is the part where I'm going to thank everybody who has spent 3 days with us. This has been really fascinating. We're going to start planning our 10th annual Global Health Summit shortly after this. Steve, Stephanie, Tom, thank you so much. We've got a program. I've got to do a little advertisement here. Next Thursday at noon, we have a program that complements what we've been talking about for the last 3 days. On April 7th, CDC Director Walensky declared racism to be a serious public health threat. So we've got a program next Thursday at noon on racism and the future of public health with Dr. Leandris LeBird, who is the Associate Director of the CDC for exactly this issue, with Georges Benjamin, who's the Executive Director of the American Public Health Association, and Linda Goler Blunt, the CEO of the Black Women's Health Imperative. Helene Gale will be back to moderate, so don't miss this. Register now. We'll send the link to everybody who's on this today so that you can register. And while I'm pushing stuff, if you've enjoyed the last 3 days, if you learned as much as I did, and I want you to please join the World Affairs Council, make a contribution to the World Affairs Council. That's the way we're able to put on these kinds of programs. I want to once again thank our partners, CARE USA, the Carter Center, and CSIS, especially Steve Morrison, who is the Senior Vice President and Director for Health Programs at CSIS. Our presenting sponsors are the UPS Foundation, Avanos, and John Snow, Inc. I want to thank our supporting sponsors, Pain Care Labs, Dr. Amy Baxter, Atlanta Global Studies Center, the Georgia State University School of Public Health, the GSU Center for Health, Language, Teaching, and Research, Kennesaw State University Wellstar College of Health and Human Services, and the Morehouse School of Medicine, Office of Global Health Equity. I want to thank the staff at CDC and CSIS who have been so helpful throughout this week.